Hi everyone, welcome to my channel. Today I am going to deal with the topic nursing foundation, that is legislation and nursing practice. In introduction to nursing part 1, I have ended up added the responsibility to the nurse. So after that I am continuing with the legislation and nursing practice. So what is legislation? Legislation is nothing but the group of laws which has been followed in the nursing profession. So licensure. Licensure is nothing. What is the meaning of it? Licensure is nothing but the meaning is to grant the license. So we, the qualified nurses, have the license so that which protects our nursing knowledge, skills and services. So next is Good Samaritan law. This is very important law which is going to ask in the theory and the competitive exam questions. So what does it states, or what is the meaning of this Good Samaritan law? So legally protects the professionals providing emergency care like at the time of road traffic accident or bleeding. So it means that whenever you are, for example, when you are going on the road, then there is a sudden road traffic accident happens or bleeding happens to the patient. So what the knowledge you have, you go and help them, and after you will shift the patient with the help of ambulance to the nearby health center. So if the patient, suppose if he dies or if he gets any complications, then you are not responsible. So that it states that meaning of this Good Samaritan law. So it protects whatever happens. So what happens, sometimes many members will blame. So she does not know everything. Suddenly she has done everything. She is responsible that this. But this law protects as the nurses at the time of emergencies or the emergency situation. So next is the public health law. What is it? Just as the name suggests, public health law. It is related to the public. So what it suggests, it is being carried out at community settings like child abuse, elderly abuse, domestic violence, etc., or at the time of outbreaks. So autopsy. So this is also a very important question. Autopsy is nothing but the post-mortem which is done at the medical legal cases. So death with dignity, or it is known as physician assisted suicide. As the known as physician assisted suicide, it means that carried upon verbal or written request of the patient at the terminal stage of illnesses when recovery is not possible. So what happens when the patient is in the last situation or at the time of critical situation, critical illnesses? What happens because of the health issues or due to that depression level? What happens? The patient himself gives the verbal or written request to the doctor that I want to end life or I don't want this sufferings. So at that time what happens? The physicians, what they will give, they have the rights to give the medications to the